First Fix is a non-surgical nose job, and waiting in the Dr. Spa's facial cosmetic surgeon, Dr. Alexander Rivkin from UCLA, with his patient, Jenny. What's going on, Dr. Rivkin?
Morning, Travis. Good to see you again.
So, Jenny, first question, what don't you like about your nose?
Well, my main concern with my nose is the bump on the bridge. That's basically it. Kind of have I want a nice bit of that. Stream.
And Dr. Rivkin, you're doing something really minimally invasive. You're going to do what we call an injection rhinoplasty. Explain that.
It's an injection procedure of radius to lift up the skin and make the nose straighter and more symmetric. When this nose is straighter and more symmetric, it actually looks smaller. And that's what we're going to do with Jenny today.
What he's saying, he's going to camouflage the bump by putting fillers in above and below that bump to create a straighter profile. Obvious advantages, can be done quickly, it's not an invasive procedure. And Dr. Rivkin came with a couple of cases of before and afters, what Jenny has to look forward to. And you see in a case like this, he actually got elevation of the tip of the nose by injecting in the base. It looked like he had a hump by injecting into the nasal frontal angle where he was low. It straightened the profile of the nose.
That's all non-surgical, huh?
Non-surgical, and in this case, he has a little bit of a scooped look to the nose. This patient wanted more of a straight profile, so we augmented, added to the dorsum of the profile with this Radius project, and those are very nice results.
And Dr. Rivkin, do you mind if we peek in while you start the procedure? We're going to check back in with you for the results later, but can we?
Absolutely. What we use is numbing cream to really make this as comfortable as possible. Okay, so we'll start with the top of the nose here, and you might feel a little bit of pressure. Do a little injection right in here in the skin.
And you're injecting down to the bone, correct?
Down to the bone, all real quite deep. And just little bits, and that's all you need. Already, it's starting to look much better.
That's similar to that case in that gentleman where it was sort of a bump in the middle, so he's injecting above and below, which should leave her with a straighter profile.
Well, we're going to, Dr. Rivkin, tease the rest of the procedure, so you go ahead and continue with your assistant, Roseanne. Keep at it. We're going to see those results in a few minutes.